So I have to say, I've got a bit of a cough, so I'm hoping I'm not going to have a Theresa May moment, but Elizabeth is there with a cough sweets just in case. So I'm going to be talking about a research programme that we started, I guess, about 3 years ago now, on teaching effectively all children. We like acronyms, so this is called TEACH, and I, together with colleagues and part of the REAL Centre, the Research for Equitable Access and Learning at the University of Cambridge. And this project in India and Pakistan is together with colleagues in CORD, which is a research institution based in India, and IDEAS, which is another research centre that is based in Pakistan. So we're quite a large team, and Manaza Aslam, who some of you might have met at some of these seminars, is also part of the research project. And as I think you know, this is part of the Raising Learning Outcomes programme that is funded by the Economic and Social Research Council and DFID. So I'm going to, this is the sort of broad outline of what I'm going to be talking about. I'm going to be just starting by giving an overview of our TEACH research generally, but I'm going to be zooming in more specifically on the work that we've been looking at in relation to disability, showing why this is important, the sort of profile that disability is now getting on the global agenda, how our research is identifying patterns of disability prevalence, in particular in relation to educational access and learning, and focusing on our work in Pakistan. I would say that actually a lot of what we're finding in Pakistan is very similar in India, but there are some differences, and I can sort of identify those as I go along. And in particular then also at the end identifying some of the issues for policy and practice. So just to start very broadly about what TEACH is about, so we started out by really wanting to understand how markers of social disadvantage, such as disability, poverty and gender, result in children not learning in government primary schools. Now, as many of you are probably aware, there are huge numbers of children who aren't learning. As David said, I used to work for the Global Monitoring Report, direct the Global Monitoring Report, and for one of those reports we estimated that around 250 million children are not learning the basics in literacy and numeracy. So we know that there's a problem, and we know that many of those who aren't learning are those that are coming from the more disadvantaged backgrounds. So we wanted to understand this interaction better. And in particular, I think one of the things that's been particularly unique about our work is this focus on disability and the interaction of disability with other markers of disadvantage, so recognising that there is intersections between these. But of course, it's not only enough to identify the problems, one also wants to identify the solutions. So we were wanting to also then say, okay, having identified these problems, what are the effective teaching strategies to raising learning outcomes, particularly for these disadvantaged groups, and as I said, with a focus on children with disabilities. So I'll sort of go into in a moment the sort of number of schools and the sort of sample that we had for the work, but just to give a quick picture of the sites that we went to. In both countries, we obviously couldn't go to the whole of Pakistan or India, so we focused in on particular parts of the countries. We wanted to go to parts of the countries where we did expect children to be in school. So some parts of Pakistan, the levels of access would still be extremely low, not just for children with disabilities or for those from disadvantaged backgrounds, but generally. But at the same time, we didn't want to go to sort of the urban sites where things were more advantaged. So we went to rural areas in both countries, and through a sort of random selection of the sites, came up with quite a range of different environments in the settings. Now in Pakistan, as is generally the case, most of the schools we went to were either boy only or girl only. There were some mixed sex, but commonly they were single sex. And as you can see here, sort of a variety of types of settings of the schools. So the two at the top are two of the boys' schools, and the two at the bottom, two of the girls' schools. This one here, they're outside not because they're trying something creative, but because there weren't enough classrooms. Whereas this one here you can see is sort of quite nicely designed with pretty things on the walls. Similarly here the setup is better, and again here it's obviously a little more tatty. So quite a variety of types of school environments within the range of schools that we went to. So So our research was a mixed methods approach, including both quantitative and qualitative methods. As I said, we sort of focused in on particular areas of each country, so Haryana state in India and part of Punjab in Pakistan. We focused in on 3 districts in each of these and went to 10 villages per district for the quantitative, and then a smaller number for the qualitative. We focused on government schools, even though, I mean, as you might be aware, in both countries there is quite a prevalence of private schools, including low-fee private schools. But we, from other evidence and analysis that we have done, we were aware that most of the disadvantaged, or the most disadvantaged children are more likely to be in government schools, and given that was what our interest was, we were particularly keen to look at the government schools. But also, despite the fact that there are large numbers of children in private schools, still the majority of children are in government schools. So if we're wanting to address effective teaching, we do need to tackle that in the government schools. So we did debate whether to go to a mix or whether to only focus on government, and we decided to focus on government, given that we couldn't do everything. And we went to around 1,000 households for each country, and that led to a sample of around 1,500 or so children within the age range that we were looking at of 8 to 12 years. For the qualitative sample, we obviously zoomed in and focused more. We went to 6 schools in total, where we really sort of got a more detailed picture, both through observing teaching within the classrooms as well as interviewing teachers about various things, which I'll mention in a second. So we had quite a range of different research instruments, and when one does this research, you get very excited at the design stage of thinking, we need to do this, and we need to do that, and we need to ask these questions, and then you come up with all this data at the end, and you think, okay, now we've got rather a lot to deal with here, and we're at that stage now. They're thinking, okay, how are we going to deal with all these exciting data that we've got? So we had a household survey that gave us some sort of basic information on household characteristics, information on levels of poverty. We importantly identified children with disabilities, which I'll come on to in a moment, and we did learning assessments of various kinds. So we did literacy and numeracy tests, but we also did other forms of assessment which we were keen to sort of do in order to be more inclusive of children from different backgrounds, so including non-verbal reasoning and looking at self and peer relations. We also got information on parental attitudes to children's education with the children from different backgrounds, and also the literacy of mothers themselves. We then also went to the primary schools, so we were focusing here on children aged 8 to 12, which was in both countries comparable with students who are in around grades 3 to 5 in primary school. And again, we assessed children in their learning, both at the beginning of the school year and at the end of the school year. So we were wanting to identify the extent to which children's learning had improved over the course of the school year, in particular in order to see what the value added of teachers with different characteristics and backgrounds were. So I'm not going to present on that. Hopefully Manaza might present on that at some point. She's been doing a lot of the analysis on this, and actually that's what she's going to be presenting at the conference that's coming up in Mexico that some of us are going to, the Comparative and International Education Societies Conference, so watch this space. We also did a survey with teachers for which this analysis was also being used in terms of looking at this value added, where we got some factual information about the teacher's background and so on, but also their attitudes and experience of teaching children from different disadvantaged backgrounds, and again their particular perspectives of teaching children with disabilities. And I think there were some quite interesting things that are coming up from that. So in addition to complementing the quantitative data that we've collected, we also, as I said, went in more depth in terms of looking qualitatively at some of the attitudes and experiences of teachers, and we focused in on, in particular, trying to understand in more detail what teachers thought about children with different abilities, who had different forms of disabilities, and how they dealt with children from these different backgrounds, and also children who they identified as being low achievers. So we asked a sort of range of different questions trying to get at their understanding of diversity, etc. Yeah, is this okay? This is sort of feeding back a bit. Oh, he's upstairs, okay.
With these schools, did you choose ones that had a certain percentage of disability or disadvantage? Or was it just as...
So good question. So, I mean, I think in terms of how we identified these 6 schools, we were particularly keen to make sure that wherever possible there were children with disabilities within them. So that was one of our key selection criteria, because it wasn't necessarily going to be the case that there were going to be any or many in those classes. So that was our primary selection criteria.
And I just know teacher perception, if they haven't taught a disabled student, is it's going to be really, really hard until they actually get into it.
Exactly. So there were in all of the classes at least one child that had been identified with a disability. And I'll come on to how that identification had happened. Yeah, that's a good question. In addition to asking the teachers about what they were doing, we also observed the classes and observed more than once, the teacher more than once, because obviously observing first time there might be a bit of the teacher being a bit nervous about some people being in the room. Over time they relax a bit more, and I think, as many others find in doing classroom observations in these settings, actually teachers do relax quite quickly. I think it's not, although it's not a natural setting still, it is, you do get quite a lot of information about the type of teaching approaches that are going on in those settings. So there was, I think, quite interesting information that we got from those classroom observations, and what we did for those observations, we both had one person who was observing the teacher, and in observing the teacher, seeing in particular how they interacted with different children in the household, and this was using a narrative approach. So sometimes these classroom observations are using quite a structured quantitative approach of how many times you see a teacher doing something within 5 minutes. We weren't doing that. We were wanting to get a more detailed understanding of what was going on in the classroom. At the same time, another of the observers was observing 4 children who we had pre-identified in the class, who were identified as being a low achiever and a high achiever, and that was using the data that we had collected from the learning assessment. And also, wherever there was a child with disabilities, that was also one of the focal points of attention, and we also wanted to make sure there was a gender mix. So we weren't identifying explicitly who these children were. We didn't want to stigmatise them, but we were making sure that we were able to identify how teachers were interacting with children from different backgrounds. We thought trying to do that across the class as a whole would be quite difficult to get a detailed picture because so much is happening. So we zoomed in on that. We then have also tried to think about some innovations in different forms of learning, recognising that children, for example, with visual impairments might not be able to do some of the tests. We've tried to do some more tactile assessments, which we've been piloting rather than fully implementing, and also getting at some of the sort of interviews with key stakeholders. So as I said, quite a range of different methods. I'm going to be focusing more on the areas that I was mentioning in relation to where we've identified children with disabilities within the household survey and linking that with their learning, their access and learning. And I should say, hot off the press just today on the website is this new, first in our Real Centre series, research and policy paper. So do go to the website and download it. It's together with our colleagues in Pakistan. So this is focusing on the evidence in Pakistan that is looking at the evidence on access and learning for children with disabilities. That's what I'm going to be focusing on in particular, and you can read more about it there. As I mentioned at the beginning, just to put this into the global picture, as some of you might be aware, disability is now on the agenda like never before. I don't know, have any of you working on disability in particular? So I don't know whether you would agree with that or whether you think it's been something that's been around for a long time.
Well, what I'm trying to do is in Rwanda trying to help teachers identify children with more of the mild end of learning difficulties to attest to fine motor skills, as opposed to children that people can necessarily see straight away have disabilities.
And I think actually one of the things that's coming out of our work is the importance more of really helping and supporting teachers in that identification, how one can do it in ways that is potentially not intrusive, that is possible to do at scale and in low resource settings.
Easy to implement.
Yeah.
So it shouldn't be, I don't want it to to be a difficult task to have to train somebody up to do it. And then you're right, that I'm not dealing with the second part, but then the second part would be then, because the tendency is children who have learning difficulties tend to sit at the back of the class, is then have the teacher be conscious of making sure at the front of the class, or if they're not at the front of the class, are they there on top, sort of monitoring it, or not going into that at some stage.
Yeah. And so just as an aside, which isn't part of what I was going to present specifically, but I think quite an important point in relation to our work in India, we found exactly that same thing. You speak to the teachers, and often they're aware of the importance of the seating arrangements, but the reality in the class is that the child with a disability is sitting at the back, and often with nobody sitting next to them. So everybody else is paired up, and they're the one on their own, which is obviously not what you would be wanting. You'd be wanting sort of peer learning and support. And so the awareness of the teachers is there, what's happening in practice is different, and there are various reasons for this. I don't think it's necessarily the case because teachers are being negligent, but they themselves are being kept to a regime where they're held to account for making sure the majority of their children are learning. In India, actually in Pakistan as well, the children were having monthly assessments, and the teacher was having to get through the curriculum at a pace. If most of the children didn't get through the curriculum, the teacher was penalised, the teacher was sort of black marked. So it was preferential for them from that perspective for small number of children to be left behind than it was for the majority to not be keeping up at the same level as the curriculum, which was going at too fast a pace for most of the children anyway. So a common story, but it's sort of the accountability mechanisms are not there for inclusion, so it's sort of that mismatch between what they know that they should be doing and what's happening.
Come from the head teacher. So mine's a private school that I've got there. It's my own school, and but going in from the get-go, it's the only disability compliant primary school in Rwanda, and from the head teacher downwards, they are conscious of kids who have whatever disadvantage it might be, and to make sure that they are marked, in their performance in helping those that are disadvantaged, rather than just simply pumping through to meet those high grades, of which there's a lot of pressure on parents. So you've got the disparity between what parents want and their own children and their own needs versus the ethos or the ethos of the school itself, which may not be completely in sync with what necessarily parents want.
So I think there's some synergies with some of the things that we're finding as well. I think, so just coming back to the global picture, I think one thing when you trace back and sort of with my hat of working for the Global Monitoring Report, our goal, our mandate was to track progress towards the education goals. And is everyone familiar with Jomtien, the Jomtien Education for All? Has that all been covered with Jomtien? Excellent. So Jomtien, did it mention disability? It did. So Jomtien does mention disability, but nothing much happened. And then the Dakar Framework for Action also mentioned special education needs rather than disability, but it actually downplayed it. It wasn't very a clear focus. And of course, Dakar was there alongside the Millennium Development Goals, and the Millennium Development Goals trumped the Dakar Education for All goals in many ways, and the Millennium Development Goals had quite didn't really have a strong focus on inequality in general, and didn't mention disability. I mean, disability wasn't the only marker it didn't mention, but disability was not there. So it was really not really given much attention and focus, and this is one reason why some of us would argue that through the Millennium Development Goal era, while progress was made in education and in other areas, not as much progress was being made for supporting and promoting the access and learning for the most disadvantaged groups, so they were being left behind, and in fact some countries, the gap was widening quite significantly. So the Sustainable Development Goals have actually changed this from, at least at a sort of global rhetorical level, of really giving a strong focus to no one left behind. So the Education Goal 4 specifically has two targets that mention disabilities. So this is quite a move forward, that not only is no one left behind, including children with disabilities, very strong throughout the SDG framework, but within education there are 2 specific targets. So there's this one which is about eliminating disparities, which includes persons with disabilities, and another is about more the sort of mechanisms for achieving that, which is about the need for education facilities that are child disability and gender sensitive, that are safe, non-violent, inclusive and effective learning environments. Yeah.
If you were to ask schools where they put children with disabilities in a ranking of the problems that they face, realistically, would they make the top 10? I'm talking about schools in poor areas, so not wealthy, well-resourced, you know. And I'm asking this because I'm from South Africa, and I'm thinking about it from our perspective, where there are activist organisations suing the government because schools don't have basic toilet facilities, or there isn't running water, or there are still 50 kids in one classroom, or the teacher isn't turning up a lot more days than they shouldn't be turning up. And whilst, I mean, we, for example, have an inherent recognition of the rights of the disabled or those with disabilities in our constitution, we've got enough trouble getting the government to apply some of the even more basic things about providing education before we can get to, I mean, I know that sounds callous. I'm concerned, and I'm saying this as somebody who, you know, probably falls on the side of this, but where does this, you know, I think it's become quite a hot topic, but I'm concerned that this is now us from a Western perspective saying, oh, we've got a flavour for disabilities in the context where, as you say, the teacher's main problem is that they're still having to get through a curriculum that may be too fast or maybe too whatever it is.
So I think that's where I would argue that if we're talking about inclusive learning environments, and inclusive learning environments means that you're going at the right pace for all children, so that means that the curriculum as it currently stands in these contexts of India and Pakistan that I was mentioning are actually failing the majority of children, and if they were actually including children with disabilities, it would be inclusive for others as well. And I guess it also comes to the question as to what we're understanding by education, because I think, as I come on to, you know, classes are actually quite mixed and diverse, and education is about social relations. It's about how you work together, how you support each other. So I think it's about that sort of common understanding. Your question sort of started about whether, if you were asked to ask teachers to rank. I think interestingly, you know, when we went into the interviews with teachers, we weren't sort of zooming in and saying we're asking about children with disabilities. We were starting more generally, and they were showing concern and awareness of the importance and need to support children with different abilities, and that would mean both in terms of where children were on the learning spectrum in terms of their learning outcomes, but it would also be identifying that there were some children who were struggling more than others because they had different types of disabilities. So I do think teachers were aware, because as enrolment has increased in these contexts, their classrooms have become more diverse and they have to cope in those classrooms, and therefore they're aware that it's something that they need support with, and they need mechanisms to know how to tackle it. So I don't think it's necessarily an either or. I mean, everybody needs clean water. Okay, it's only some children who will need a ramp, but that's not going to harm anyone else by having a ramp. But that's going to mean that some children could go to school who otherwise wouldn't be able to go to school. So that's just a sort of crude example.
I guess the schools already had all the toilets. Because I think what Daniel was saying is some schools in developing countries don't have toilets, teachers don't show up. So like disability is something you think of when you fix those things. So I'm assuming those schools have the toilets, or I don't know.
So these schools, I mean, as I showed the pictures, they're quite diverse. They certainly weren't well resourced schools. There was nothing special about these schools. They were just government schools in India and Pakistan, which aren't particularly well resourced. One thing I would say is, again, various things that come up. One is about the teacher absenteeism, that, I don't know, David, what your view is, but I find that a lot of this analysis that's coming up about saying large numbers of teachers are absent, we often don't know why they're absent, but actually in the schools that we went to, the teachers were often there. and it wasn't that they knew that we were coming and therefore they were ready for us. So I think there's a sort of bit of a mismatch sometimes between those large World Bank figures that come up on teacher absenteeism and the reality, and where they are absent, it's often because they're being called out for duties that they're being asked to do, not that they're not there. So I think that's a whole other kettle of fish and a whole can of worms. But then the other point was about, okay, the resources aren't there, that there are other resources that aren't there, but that's again where I would come back to an inclusive learning environment is one that does need good toilets. That's something that everybody needs, regardless of whether you have a disability or not. So it's not an either or, you need to have that.
But in terms of, I'm not, I just think maybe like from a perspective of a developing country, in terms of numbers, you first want to like if you can't even provide something that enables the 90%, or you know the statistic, the 95% non-disabled, you're not going to focus on the 5% until you, ideally in a world full of resources, we would focus on only 100% together, but maybe it might be that from their perspective, they still haven't got enough resources for the 95% aren't disabled, so to them it seems like it's focusing on disabilities maybe a privilege of developed countries.
But yeah. There's some things that you can do that it's using the same resources but it helps the disabled as well. So it depends on what you're spending your money on. It's not either or all the time. Like sometimes it is, and so then sometimes maybe the cost would be a thing, but sometimes it's the awareness and understanding would mean that all people would be able to do it and it doesn't cost anything extra. And that would
also depends on.
Sorry, you were wanting to come in. Yeah.
I have a question on how effective their teaching is in general. So do they address the needs of the majority effectively, and they're only concerned that they cannot really tackle the needs of disabled children, or is it in general they feel that they need this support and service training to actually help them to teach the rest of the kids and the disabled kids at the same time?
So I think it's probably quite difficult to generalise across all of the teachers that we interviewed, but I think I would say there was a sort of would be a diversity of responses on that. Some were, and also from the observations, were really quite keen to make sure that they were inclusive in their teaching practices, and they were trying strategies, and I'll come on to this towards the end of how they were trying to do this. That might have been a minority, but it's not that there weren't things that some teachers were actually trying to tackle, and that might actually be lessons more generally. And so I can come back to this, but I think one of the points that our research would argue is that there are things that teachers are already trying to do, at least some teachers, and we can learn from that, from these strategies that they're trying to do, that not necessarily at the moment they don't have as much support and training as they might need, but it's not necessarily that it's costing a huge amount of money. So there are some things, just things like moving the children from the back of the classroom to the front of the classroom doesn't cost you any money. Yeah. It's about actually where you're putting the balance of attention, and how you're making sure that you're being more inclusive in the learning. So I think that's not to say that that can address all forms of severities of disability, but there are starting points that you can work with. And I should also say, I think I'm focusing and zooming in here on disabilities, because that's the focus of the presentation, and also what we're particularly keen on focusing our research on, given it is an area that had been actually quite seriously neglected. But as you can see, neither of these are focusing only on disability. They're looking across different disadvantaged groups. So one could make so should we be only worrying about Indigenous people once we've got everybody else sorted? Should we only be worrying about the girls once the boys are all learning? So I think we've got to be careful, in my view, of that argument that we worry about the next group once we've sorted out the ones that are easier to reach. Actually, we should be starting with those that are hardest to reach, and the easier to reach will benefit alongside them.
And I've got a definitional question for you.
Yeah.
So a lot of the articles I've been reading, they refer to sometimes disability, they refer to special needs education or special educational needs, and they refer to disability and special needs education. How in your mind do you distinguish between disability in education and special educational needs, or is it a false, is trying to differentiate between the two, completely false thing to do.
Yeah. So I should have prefaced this talk by saying I've come into this not as a disability expert, but as somebody who is concerned about inequalities in education. Our colleague who we're working with on this, Dr. Nidhi Singhal, is a disability expert, and one of the sort of discussions we've had is about these issues of terminology. And when I come on to how we've measured disability, I'll sort of raise that again. And actually, I've just recently written a chapter of a book that Nidhi is putting together, together with Paul Lynch, who I think was another of your speakers, tracking the progress across the different Jomtien, Dakar, etc., where this language shifts. And it shifts in ways that one doesn't really understand why it shifts or what the different meanings of it is. So I'm just using the word disability as it's being used in these documents. I'm not myself making a judgment about whether it's the right word or meaning something different.
Someone reading these documents, I want to understand what do they mean by that.
Yeah.
See what I mean? So, I mean, my instinct is they're mixing the two up completely. They are, you know, when they're saying special needs education or special educational needs, they're assuming some form of disability when they're doing it. Or am I wrong in thinking that? You're looking quizzically. So
Yeah.
I think certainly in the UK, disability would certainly be inclusive of physical disability.
Oh, yeah.
Of course, there's been a big movement on inclusion, which includes physically disabled people with able-bodied people in the same classroom, and special educational needs, where they're able-bodied people but with cognitive learning difficulties. And I think it's separated, certainly from the point of view of provision in the UK, so you'll have educational psychologists and SEN type people who focus in on one, whereas the disability debate is elsewhere. But I mean, it's an interesting point.
And I would say that my understanding of the way these global frameworks are using it, and again I'll come on to sort of the identification strategies in a moment, is in the broader sense of it's not only focusing on the physical, hearing and visual impairments, but also on the intellectual impairments, etc. as well. I would say, sort of from what I've observed, the former are getting more attention because the latter are still sort of more difficult to identify in many of these settings. But I don't think this is intended to be exclusionary of those different either forms or severities of disability. Is everyone aware of the new DFID education policy that came out, I think, 2 weeks ago or so? So worth a read, an analysis to see what you think of it. I think it was about 8 months in the making of going through different processes, and I think in the meantime of those processes there were sort of obviously various changes that happened within DFID and have come out with a document which I think overall does set out quite a clear and important agenda for a focus for DFID, and in that focus it includes an overarching focus on the importance of good quality teaching, which in some ways one might think, well, that's a no-brainer, we're talking about education, but you'd be surprised when you look at a lot of education documents, they sometimes hardly mention teachers and teaching. So I think that was a really important sort of starting point. It also has a strong focus on systems of education, improving issues around accountability, etc. And the third pillar that it has is around targeting specific groups that are identified as those that are most left behind. And amongst those three groups are children with disabilities. The other two are the hardest to reach girls and children living in conflict situations or affected by conflict. So again, I've just pulled out the quote on disability. That's not to say that's the only thing that it's focusing on, but just from the point of view of what we're discussing today. And I think what's interesting here is that DFID has committed itself to showing new global leadership in education with disabilities, ensuring that larger numbers can transition into mainstream education and learn. And I think sort of one thing to note is that this idea that they're going to take global leadership, because at the moment, in a sense, there is a vacuum at the global level. If we think of who would you think of as the global actors that are focusing on disability and education? Are there any that you can think of?
Me?
Okay. maybe with DFID support then you can...
Yeah, okay, so this again, I think creates a problem.
Yeah.
Because the assumption there is that there are children with disabilities, which is absolutely right, there are children with disabilities, particularly in developing countries, who are not in mainstream education. But my sort of shtick is there are loads, there are probably 5 times, 10 times as many kids who are in education, but who do have some form of disability that is not being identified, and therefore they are not effectively capitalizing on the education in the classroom where they actually are.
You're doing all the spoiler alerts for what I'm about to show. So no, exactly. I think that's very good message, which is, and I think that's why, in a sense, this focus that they're putting on mainstream education is important. As you say, it might be implying that that's not happening at the moment, and that is something empirically that we need to identify, and I'll show a little bit about that. And I think, but the other important thing is it's not just about getting them into school, which a lot of the previous approaches have been talking about, children with disabilities being out of school, large numbers out of school, but then not particularly showing much concern for what happens for them in there. So I think this and learn is also really vital. Now it's again an obvious point, but it needs a focused attention if we are going to make a difference. So now coming on to the question about how we identify children with disabilities, coming back to the discussion we were having a bit earlier. So again, when I was writing this book chapter, I think almost every edition of the Global Monitoring Report said, well, we can't say too much about disability because it's been difficult to measure and there are no data. So this was from the 2016 report, that we need an operational and internationally comparable measure of disability, and this has remained elusive, and this is partly because it's very difficult to do. It has diverse forms and also issues around ethical and cost implications. So there have been concerns about whether there's stigma attached to identifying children with disabilities and people with disabilities because of the numbers and the sort of potentially small numbers, so you need very large samples to do anything meaningful. There are cost considerations of doing that, and if you're going to get meaningful information, if you go down a route of diagnosing through a medical assessment, then that's obviously really expensive. So recognising all these problems, there has been progress in trying to do something about this. So have any of you heard of the Washington Group on Disability Statistics? So what the Washington Group on Disability Statistics, this is it's a group has come together who are experts on disability, who recognise that this was a huge difficulty, that on the one hand we knew that in order to really be able to identify the extent of the problem, not just in education, but also more generally of the problems that people with disability were facing in access to basic services, etc., and to identify solutions, we needed to have better ways of identifying who they were, where they were, etc. But that this needed to be done in a sensitive way, not in a way that was going to stigmatise, that was going to be cost effective, etc. So they have established a set of questions, and there's a variety of these questions which include a set that is specific for children, and there are another set that are a shorter set of questions which are for adults. So the ones that we've used are the ones that are for children, and they adopt what is called a functional approach, and actually they don't use the word disability, they use the word difficulty. So they identify the extent to which children face different difficulties, and I'll give an example in a moment. They're age appropriate, so they're ones that for this age group they're the types of difficulties that might be expected, that children within this age group might be expected to face in particular. They rely on the responses of the caregiver, so it's not diagnosing the child medically, but it's asking the mother, father, house or other member of the household to answer questions about the different children in the household. They're set up in a way that allows for international comparability, which is important from the point of view of the Sustainable Development Goals. Obviously that's not the only reason for doing this. And they have adopted rigorous standards, so they have been tested rigorously to ensure their reliability and validity across different contexts. So to give an example, these are the sorts of things that are included. So going back to what we're meaning by disability, as I said, they're not using the word disability, they're using difficulties and functionings. So there's a range of different things that are included: seeing, hearing, walking, self-care, whether they can understand the child's speech, issues around learning, remembering, controlling behaviour, whether they have difficulties in focusing, in routine, in making friends, and being worried and sad. And some of these questions, they ask them in comparison to children within the same age group. So the caregiver is asked, so does your child have more difficulty in making friends than other children in the community, for example? So it's a relative, and they sort of, rather than trying to make them give an absolute judgment. For example, on the question on the visual impairment, question is asked whether they wear glasses or not. If they are wearing glasses, do they still have difficulty seeing? If they aren't wearing glasses, do they have difficulty seeing? So there's a sort of a range of questions which are asked to get at the extent to which they have a visual impairment, and then there will be a similar set for these other questions. These questions have been asked in a variety of settings now, and as I said, they've been sort of tested to try and make sure that they are assessing what the intention is of what they're wanting to get at. So we use these questions, and they're available online. They're sort of a open access set of questions which are publicly available, and we use them in our household survey. So with these 1,500 or so children, got information on the extent to which they were facing these difficulties, and the respondents were primarily either the mothers or the caregivers of the children.
So can I just ask,
Yeah.
the ratio of households to children there, that looks relatively low for fairly deprived areas, or is that because these are disabled children? And
This was all the children within these households that were aged 8 to 12. It's only the 8 to 12-year-olds, though. It's not all of the children. Yeah. I mean, we did collect other information on all of the children, so there was more information, but for the more detailed questions, we...
That's 1.5, 8 to 12-year-olds per
Yeah.
household. Okay, I'll take that back.
Can I just ask a question about the
Yep.
sort of global nature of these? I think it's quite compelling to have measures on things, and so we're interested in knowing, how many children out of disabilities, however that's defined. You can kind of see that people might want to group together and say, really need data on this. But does that produce a sort of conflict to where data is quite useful when it's specific? So in some countries we know, there's kind of river blindness, so you need to know how many kids have river blindness or stunting, and health surveys pick this up. And because you have specific information, you can respond specifically. So I just wonder about a kind of global measure. I know it perhaps helps us in education, but does it actually, is it helpful elsewhere?
So these questions haven't been established for education specifically, so they're being used in, I don't know if you're familiar with the UNICEF multiple indicator cluster survey, mix surveys. So they're being used in these UNICEF surveys across a number of different countries, not education specific. There's lots of health questions and other things within demographic questions within those surveys. And they actually, I think we're probably the first that have used them in a specific way in relation to education. You're right, I don't think this is suggesting that this should necessarily be the only measure that's used, depending on what the purpose is, and sometimes there might be needed for triangulation, there might be a need for more focus depending on, as you say, if there's sort of particular forms of difficulty that you might expect in specific environments. So actually, I missed, we had a Real Centre seminar today, which I missed on coming here, but I had a discussion with the people that were giving that seminar beforehand, who run private-public partnership schools in Uganda, in disadvantaged secondary schools in parts of Uganda, PEAS schools, which you might have heard of. And we got onto a discussion with them because they have been using these Washington Group questions, or a version of them, to identify children with difficulties within the schools that they're working in. And they said exactly that they were also using some different measures as well, and sort of looking at the sort of comparability, and they were, in a sense, having different purposes for their work. So in looking at this information, what we find is that, in some ways not surprisingly, what we would suggest is that a lot of the previous estimates of disability are quite large underestimates. So the population census, which there has been one more recently, but it didn't include a useful measure of disability within it. So the last one was 1998, and that had a disability prevalence of about 2.5% of the population. There was another report that collected information on disability that came up with about 2%. Are you familiar with the ASA surveys in India and Pakistan? So ASA citizen-led assessments that have collected information on basic literacy and numeracy in India and Pakistan, and there's also been ones done in parts of Africa. And we work with the ASA colleagues to include the short set of Washington Group questions, so not all the child functioning questions. And they had a prevalence rate of about 1%. They had a very large sample. They covered a large number of children, but the prevalence rate was quite low because they only covered a subset of the forms of difficulties. When we used the full set of difficulties in the Washington Group questions, we came up with a prevalence rate of about 11%. And when you look across other countries, this number of 11% is more common. I mean, that's more in line with what one might expect. So the question, for example, in the population census was just saying, does anyone in your household have a disability, yes or no? I think it's probably not surprising that that's going to end up with an underestimate. So this more detailed approach and going through different forms of functioning difficulties gets a more nuanced approach to understanding where there might be those difficulties. I think this is quite an important thing, and it comes back to the question in a way when you were saying, okay, if we're thinking there's only 1 in 100 in the class that's got difficulty, then we might be thinking that's only a very unique thing. But if we're saying there's about 10, that's actually not an insignificant number.
Yeah. How do we disentangle from this the changing definition of what constitutes a disability? I mean, we're obviously becoming more sensitized to the issue, and it is something we're realizing may underlie a lot of other things where once, you would have the problem child, and that child is a nuisance. Well, it turns out said child may well have an undiagnosed difficulty of some kind. I mean, I think that's where Brooks's interest in this comes from, is some of it at least, from what I've heard from him, is that in some cases that it's that failure to diagnose it then leads to knock-on effects of all sorts. And clearly that is one of the reasons why we're interested in this from an educational perspective, the potential for small changes to allow for much less disruption or a much more increased rate of integration. But there is a sort of a definitional issue of, have we kept expanding what we define as being disabled? I mean, once upon a time it was blind or deaf or in a wheelchair, and that was pretty much it as far as I'm being very, very blunt about this, but I mean, so I'm hearing impaired, and a lot of people would say, yeah, that's great, you can still hear, thanks a lot, off you go. And that's fair enough. Now, of course, we're saying, well, what we define as being a disability is I think some of it
Here's the answer.
I think some of it that we're giving access to people that it actually works out better to mark yourself as disabled or to note.
Okay, this isn't asking people to mark themselves as disabled, so I think that's not what this approach is.
The
but
whole point, I can't believe I'm a conservative saying this, you don't get. But the whole point of this is that every child matters, right? So okay, so to sort of have this sort of 80-20 thing in your brain, or 90-10, in which, well, we're limited resources-wise, this developing country, well, sort of stuff the 10%, and we'll focus on, just a second, let me finish, we'll focus on the 90%. You know, if you're the parent of that child and you're sending that child to that school, you know, the expectation is that that child is going to be supported in one way or another. Yes, some children need more support than others, and I get that, and I get as maybe a parent of an able child, you don't want your child to suffer because the teacher is spending an inordinate amount of time on that child who's got learning difficulties. But at the end of the day, there is a balance, and every child, in my view, every child to school deserves to be supported, and we need to get that balance right. But what we shouldn't have is a system whereby certain children are just sort of left there to rot at the back of the classroom.
Agreed in moral principle. But in
No,
practice, when you're talking about countries where we can't deliver, I mean, where we're talking about children who get to grade 4 or 5 and they cannot read, and I'm not talking one or two of them, I mean, the last statistic in South Africa is that 80% of children in grade 4 cannot functionally read. And then we're saying, well, let's look at the minority, the really specialized cases where teachers need even more training. If these teachers are able to teach the kids to read in the first place, then I think we're worrying a little too much about specialized training for something beyond
But
that.
I think that you think that the specialised training has to be ridiculously specialised and only helps them 10%, because I actually genuinely, as somebody that's had to teach a kid that's blind and had no specialised training in that, what I realised was small changes actually made me a better teacher for the 90%. And if they're already not being able to teach because there's no literacy, whatever that is, maybe a small amount of training to help the lowest performing students will actually mean that they can teach the 90% better.
So I think that's I think that's
what's tending to happen is that it just gets added to the list.
So I think
and
that
teachers in normal schools where we've gotten to this integrated approach now, we've said children with special needs shouldn't be sidelined, they would be integrated into the classroom. Well, there's two options for the teacher. You do spend disproportionate time and effort, or you're left saying, I'm not sure what I'm meant to do about the fact that that child becomes disruptive or is left to their own devices.
So I think that point is a really important one. Also, I would say, I mean, in South Africa, it's very sort of clear when you disaggregate the data, it's some children who aren't learning, it's not all children who aren't learning. So there's huge inequality gaps. And those inequality gaps are driven by poverty, but also other factors that intersect. I mean, as you were actually also indicating earlier, and that's why it's important to identify the children who aren't learning and what type of support they need to bring them up, because it's not that no children are learning in South Africa.
Disadvantaged and disabled, because there's probably a large cohort in that 80% who probably have come from hugely disadvantaged backgrounds as well. So, you know, and you can define that as disabled, but you can define all as disadvantaged, but your definition of disadvantage is different depending on which child you're focusing on.
And I think one of the things that we would really want to stress is the intersection between these forms of disadvantage, that it's not that they can be separated out.
They're all physical disadvantages, like. So
No.
the percent have some of the
So the ones that we are looking at.
physical and psychological, but not economic disadvantages.
So we would be, okay, so maybe I'll get on to the next slide. So we then have looked at the interaction between the different forms of disadvantage. This is from the Pakistan sample. Now obviously these were sort of relatively poor samples in poor areas in the first place. And we do see that children with disabilities are more likely to be in the poorer households. So the red bars are those with no disability, and those in the sort of blue and green are the moderate to severe. So you can see that the moderate to severe part is larger for the poorest 25%. But it's not to say that there are also children with disabilities in the richest, which was not surprising. There's a relative similarity between girls and boys, as one might expect as well.
Isn't that just a natural thing that children with disability appear to be in poorest family, or is it that their disability hasn't been addressed at the early stages to be in, well...
So there would be a variety of reasons. So I think it's sort of one of the reasons is that, for example, in some of these areas, there's not sufficient food or sufficient nutritious food. There's huge malnourishment, which is associated with some forms of disability, for example. So, you know, there's going to be a variety of reasons why one might see that association. I mean, it's not a causal relationship, but it's sort of seeing that children with disabilities are more likely to be in the poorer
But
households.
also for primary education, for like mentally disabled children, if their educational needs were addressed at earlier stages, they would perform better here and perhaps wouldn't show that level of disability.
I don't know that it would change the level of disability. What it might change is what I'm going to come on and show, and in terms of whether they're making it into primary school and learning once they're there. But I don't think it's going to change the nature of their disability.
Well, it could compensate if you put enough effort into it. Some mental disabilities can compensate at early ages.
But not blindness.
Well, mental disabilities, yeah, like behavioral issues.
Maybe it would be interesting to disaggregate. So, for example, I guess behavioral probably more associated to socioeconomic deprivation then. That's my guess, but maybe.
Yeah, I mean, to be honest, we haven't disaggregated. Well, we probably have disaggregated this according to the different types of disability. I can't remember offhand how it came out. I would say one thing that we found was that there was quite a close correlation between the different forms of disability or difficulties that were identified, and that was one reason why on this analysis we haven't separated it out. There is also a more mundane thing of the sample size, which makes the sample sizes very small when you start differentiating it. Now, whether you would see much difference, we can certainly look at that as to whether there's much difference in terms of poverty and the different forms of difficulty.
It's a good point to remind me of saying.
Yeah.
So UK data, for example, very interesting. Primary schools, lots of kids bouncing about, full of energy, but a huge increase in output behaviour first thing in the morning. So they're not learning mathematics, they're not learning literacy. But sometimes it's so severe that the treatment for what seems to be treatment with all sorts of drugs like Ritalin. I mean, when it became clear that lots of problems were actually related, the UK government, put a huge amount of funding into breakfast clubs. Children weren't eating breakfast at home; they were getting a pound or so to buy a can of Coca-Cola and a bag of crisps, which wasn't nutritious. But with breakfast clubs in schools, that sort of accommodated a huge number of breakfast clubs working in poor areas in the country. So it's an interesting question, that relationship.
We can certainly look into it. Yeah. And I think, this isn't sort of an education-specific question, so we could also perhaps see whether, with the washing people that have been collecting data, using these identifiers more generally, what that association is that they found. I'm pretty sure that there would be some information on that. But maybe I think, in some ways, this is sort of one of the most important graphs is, and this comes to the point that you were saying, actually there are large numbers of children with different forms of difficulties, including those that are identified as being moderate to severe, who are in school, and these are in government schools and in private schools. They're not in special schools. These would be in areas where there isn't a special school. They wouldn't be able to access them. The special schools in these contexts, they often have to pay a fee for. It's only for a select few who would get access. Some of them might be provided by NGOs or by faith-based organisations, but it's actually the majority of those with different forms of difficulties are in these mainstream schools. So that goes back to the quote that we were looking at from the DFID policy, which is saying they're going to support children in mainstream schools. There is, as you're no doubt aware, sort of been a huge debate about the extent to which the focus should be on special schools or on including and integrating children in mainstream schools, some of the challenges around that. But in some ways, regardless of what we think is the best approach, the reality is that children are going to these schools, they are in these schools, teachers are having to work in these very diverse classrooms, and so it is a reality that needs to be addressed. So I don't think it's enough to be saying, you know, well, we can still debate whether we want special schools or mainstream schools. This is what is the reality. And I think in Pakistan, you know, there are, as I said, sort of, it's not that all children are in school, but we can see that there are, this is those with moderate to severe difficulties. The blue bar is those in government schools, so 51% of the boys, both the boys and girls, are in government schools. And what particularly surprised us actually was that a sizable proportion are in private schools. So these are often the low-fee private schools. And if we look at those with moderate to severe difficulties, we see that around 26% of the boys and 21% of the girls are in private schools. So this is suggesting that parents are not only wanting their children with different types of difficulties to go to school, but they're also sometimes paying relatively small fees, but for them it's a sizable amount of money to go to private schools. And these aren't specialised schools, as I said, these are just schools with a diversity of children within them in those communities. And I think that's important to recognise, because often it's been suggested that parents don't want their children to go to school, they keep them invisible within their household, they're hidden, etc. But actually it would seem that parents are wanting their children to go to school, and in some circumstances are paying for them to go to school. Now, of course, this red bar is smaller compared with those with no disabilities, so it's not that it's not happening to the same degree, but it is happening. And similarly, it is the case that those with moderate to severe difficulties are still more likely to be out of school, and particularly the girls. So about a quarter of the girls with moderate to severe difficulties are out of school. This is the 8 to 12-year-olds in this context. So that's not an insignificant number, but at the same time, more of them are in school, and that's what we need to be focusing both on seeing what can be done to get these children who are out of school at the moment into some form of education, but also recognising that there are many children within those classrooms. So then we also, as I said, have done these basic literacy and numeracy tests. So we both used the ASA tests, which, if you haven't seen them, I recommend looking at. They're very straightforward assessments to administer. They're quite short, they don't take much time, and they're easy to then also sort of communicate the results of. We also did a version of the Young Lives learning assessment, if you're familiar with that. Young Lives is a longitudinal study that's taken place in India, Ethiopia, Peru and Vietnam, so we used a version of those tests as well. I'm only showing here the information from the ASA tests, but we found quite a strong correlation between the results of the two tests. This was just easier to show for now. And actually, again, the thing that I think is striking is that if you look at those with moderate to severe difficulties, for these are the ones in school, actually a sizable proportion of them are learning at least these very basic things. Now, of course, you would expect by the grades 3 to 5 that they can read a letter or recognise a number. So that's perhaps not surprising, but it's not that they're necessarily falling behind. What they are falling behind is to some extent the reading of stories, the sort of more difficult things, but still there are a proportion of them who are learning. Now, we have disaggregated this by the different type of difficulty. I haven't shown it here for two reasons. One, again, because the sample size, so we sort of would be a bit nervous about making a big deal of it, and also because we did, as I said, find quite a close correlation between the different types of difficulties. But what we did find, just on a more informal basis, is that children with more mobility types of difficulties were those that were, on the moderate to severe, were those that were less likely to be getting access to school. So actually those with forms of intellectual impairments were getting into school, but when you disaggregate the learning, perhaps not surprisingly, in some ways those with the mobility types of difficulties were learning on a similar par to other children, and those with other forms of difficulties were the ones that were falling behind. So one can disaggregate that picture. because our work was done within the households, these surveys were conducted within the households, we could both look at the children who were in school, but also look at those who were not in school. So these children who were not in school, now it's quite possible that they had spent some time in school, and we can also identify that. And this is where we see the biggest drop-off between those with different forms of difficulties and those without. So if we look here, for example, at those that can read stories, only 3% of those to moderate to severe difficulties. So this might mean that these are the most extreme of the moderate to severe, and they're the least likely to be able to have been to school, or to have, if they have been to school, they've not learnt anything and they've dropped out. And similar here in terms of doing division. Yeah.
Reading stories and doing division, isn't the age group too broad, like 8 and 12? So wouldn't it be more informative to actually have information of how many 8-year-olds have difficulties reading stories, and how many 12-year-olds have difficulty reading stories or doing division? Because 4 years in school, or out of school, is a great amount of time to learn how to do long reads and how to do division. So how informative is this data in terms of the proportion of 8-year-olds in this cohort and 12-year-olds in this cohort?
So again, we can certainly disaggregate, but what you generally find, and we've also found from other analysis, is that if you're not learning by age 8, you're often not also learning by age 12. So there's a paper that I wrote with a colleague using the India ASA data. I'm trying to remember which journal it's in. I think it's in the International Journal of Educational Development, that shows that those that are starting off by not learning within those sort of... So this is something that they should all be able to do by the age of 8. So this is according to the sort of what they... the level of the curriculum, they should all be able to do by the age of 8. If they're not able to do it at that age, the problem is that they're not then catching up. I mean, I'm not saying that that's necessarily... They should be doing it by the grade 3. They should. So this is assessed. So actually, it should be grade 2. Actually, the ASA test, isn't it?
Children actually start schooling at the age of 7, so there is no way they're going to learn how to divide at the age of 7.
Oh, sorry.
They're not starting at age 7. They're starting at age 5.
India.
Okay.
Yeah. But I think, again, when one were to do a multivariate analysis, one can control for that. We haven't done that here, but to be honest, I don't think that's going to make a huge amount of difference in terms of what you see here. So it's not that these children are all age 8 and these ones are all age 12, for example. It's a similar spread. And so if there was a disparity in terms of the age groups, there were more children with difficulties who were younger, then that would be a valid argument, but that's not the case. There's a similar spread.
How does this compare, looking at the 48 and the 18? So children with no disability in these age groups being able to read stories and do division. I mean, the division one particularly, they all seem to be doing fairly poorly, unfortunately. Both the children who have disabilities and those who have no disability. I mean, 18% doesn't suggest that not having a disability is doing them a huge favour as far as their mathematics is going.
And I think that's a general point of when one looks at the results from these ASA surveys that go beyond what we've done. I mean, there's quite a lot of evidence that has been, is out there that's analysed these, and that is one general point that's been made, that levels of learning are low overall. Again, one probably would need to disaggregate this to identify according to poverty, which we've done for this other work that I was mentioning in India, and we've done it with some of the ASA and DWESO data sets in other countries that shows that the rich are much more likely to be learning. It's not to say that they're all learning, so it's still in India, as far as I recall, by the end of primary school, around 40% of them are learning these basics. So I think the point that you were making earlier and now is an important one, that it's, there is a common problem within the education system, but it's still those that are the most disadvantaged that is to do with these different forms of disadvantage that's holding them back. And for some of them, it's to do with the fact that they're either not getting into school or not staying, and that's where the sort of extreme is at the end here. And one could look at that division and say, well, maybe it was too difficult. But I think for age 12-year-olds, you would be expecting them to be doing this sort of reasonably simple division that they've been asked to do. So I think this is just intended as a sort of snapshot in some ways, and I'm sort of very pleased that it's generated this debate, because this is exactly the sort of thing that I think we need to be discussing. And what you're all saying is highlighting the fact that this isn't simple or straightforward. So DFID putting itself out there as saying it's going to be a global leader, and that it's going to be making sure that children in mainstream schools and learning is like, okay, what does this actually mean? What are they going to be able to do? And what are they aiming to do? And I don't know if you're aware, but in July there is going to be a Disability Summit that isn't only on education, but will include education. So I think sort of collectively a time to be thinking about, well, what is it that as an education community we might think is feasible, appropriate for a global leader in education to be doing in this area. Just before concluding, I just wanted to come to a few of the quotes from the qualitative interviews with the teachers, because one thing that I think struck us, and I said this earlier in the presentation, was that often there's this deficit view of teachers. Teachers aren't in the classroom, they're lazy, they don't know what they're doing. And I know, David, you've done some of this analysis showing they often don't have the skills they need to be able to teach what they are needing to teach, and that's partly a problem that they're a product of their own education systems. Unfortunately, the way that some of the literature portrays it is it sort of it appears as if the blame is being put on teachers rather than seeing it as a systemic issue. And at the same time, I think one thing that struck us was the number of times we saw teachers were actually proactively trying to do things within their classes to address the challenges that they saw. Now, they might not have been sufficient. They might have been things that we think, well, there's different ways of going about the problems that the challenges that they were addressing. But the fact that there's the motivation there's the interest there is that starting point to say, okay, these teachers are wanting to do things, and I would say that's probably more common than the teachers who are absent and being lazy, etc. What is it that we can do by building on these starting points? And I think, as we were saying earlier, this relates to sort of identifying some of those easier first steps where there are entry points to do something. Some things are going to be more difficult, some things are going to be costly, and there are going to be decisions about how one allocates resources, etc. So these are just a few quotes. So this was one and these are all from the schools that are part of the sample. So this was a teacher saying, a girl got enrolled in nursery who was both deaf and dumb, but I was able to help her teach with the help of pictures, etc. She attended school just for a year, but in this limited period she was able to learn the alphabets of English and Urdu and could count till 100. I also used to give her some extra time because I had to teach her in a different manner. I would draw dots on her notebook so she may learn how to write. So this issue about extra time was one that frequently came up. Clearly trying to do something different, recognising that the child needed some particular type of support and trying to address that. And I think it's interesting recognising that, okay, she didn't have a long experience of education and schooling, but within this time, at least she could achieve something. And you almost sort of, I don't know, my feeling is you can almost see from the way from that quote that the teacher also felt some reward from that as well. Yeah.
I just have a short question about the full effectiveness of teaching. Like on the previous slide, it wasn't just the disabled, like the gap between those with disability and ability wasn't that great. And here we have this one, I will draw dots on her notebook so she may learn how to write. But that's just a common practice. It's not how you address the disability issue of a deaf and dumb child, but that's how you could teach all children to write. So she uses that as an example of addressing the disability, whereas that is just an effective teaching in general.
But isn't that exactly the point? That if you're using an effective strategy that is working for this child, it can work for other children. This child might have needed special attention for her to be able to do it.
It should also be vice versa. If you use effective teaching in general, it would address some needs of disabled.
So that is what an inclusive education approach would be. is about using approaches that is inclusive of everybody and recognising that children who are, so if you're doing this with children who particularly need it, it's going to also benefit other children. I mean, this probably isn't enough on its own. I mean, if she was really severely deaf and unable to speak, then it might not have been sufficient. But I think it's partly about that, but it's also about the extra time that she recognised she needed to give.
But I guess like this maybe like raises the possibly interesting question of what, like, to which extent, like the extent to which the teachers aren't able to teach the disabled students because they don't have good teaching practices for all children. So maybe like the extent to which this can be also partly addressed by teaching them to teach non-disabled students in the first place, because if this is a practice that you also use with non-disabled, maybe, I mean.
But I think that's, but I think that
but
goes,
in both ways,
yeah.
I think.
I think we're agreeing.
Yeah, we're agreeing.
But I think that's not necessarily, as I'm sure you're familiar, necessarily the approaches that teachers are equipped with and skilled with to teach in these classrooms. So he has used his or her initiative in doing this. This isn't something that's common practice. If you go into these classrooms, that's not what you would commonly see. So I think this is why I'm drawing it out, not because it's sort of something we would expect, but because actually it's something that the teachers aren't trained to do, they're not given awareness of, and they have become aware through their own practice and through their own observation. So these are just some more. I give her individual attention, again the issue around the attention. After I give a lesson to the rest of the class, I call her and give her a separate lesson according to her learning ability. Now, of course, you know, that's suggesting the teacher has sufficient time and energy, etc., to do that, and the extent to which that's sustainable might be a question, but I think the point I'm trying to make isn't so much that these are necessarily the right approaches or sustainable approaches, but that there is a starting point on which to build. So the next one, children who have difficulties in learning. I often repeat the same concept, especially for them. I give them individual attention by making them sit closely to me. So the point we made right at the beginning about the seating arrangement's a very simple thing. I can easily have a look at their notebooks and see whether they are able to understand what is being taught in class or not. So I was at I was mentioning I was in Addis Ababa the other week, and there was a presentation by Ben Piper and a colleague from the Research Triangle Institute, RTI, that have done an interesting study looking at the extent of trying to include children with hearing and visual impairments, again within mainstream classrooms in Ethiopia. Again, they identified and found that there were children with these types of impairments in mainstream classrooms. That's where they were. And they did some observations where they were just doing some very simple things of looking at the extent to which the teacher was like this. So if you have a hearing impairment, then that's obviously not going to help. The issue around the importance of repeating things for children with particular difficulties. Again, this is something that's going to benefit everybody, but it's going to disadvantage some people in particular if you're doing this. So it's about awareness and recognising that some things can be beneficial for everybody, but will be particularly beneficial for those who otherwise could be left behind. Then there's another student who's good at maths but had a mental illness. We praise him and tell others that we know everything and that he knows everything, and that helps such students to be more active, so sort of the motivational aspect of it. And I think this one sums up with a number of things with this child. It was the case of getting him to participate in class to bring his confidence up, recognise the importance of actually engaging, interacting with the children with disability, with particular difficulties. I used to encourage him. I brought him to the side and told him, there's nothing wrong with you. If there is anything wrong, it's with the others. I sometimes would even threaten the other kids, I'm not sure how, that's might not go into that bit, that I would send them out of class if they made fun of him when he talked. Even though his stutter didn't go away, he became slightly more open to speaking up and participating in class. He even started making more friends because the other students knew that they shouldn't make fun of something that was given to him by God and was under his control. Again, something doesn't cost money, it's about awareness, it's about sensitising the rest of the class, and I think this is about what education is about beyond just the literacy and numeracy. All the children will be benefiting from this engagement and interaction and understanding of each other. So just a good practice generally. So just to conclude, I think what we conclude from the work that we've done so far is one important thing that is maybe not rocket science, but has not been, as I was mentioning from the Global Education Monitoring Report, has consistently been saying this has been a problem. It is possible to identify children with disabilities. It's feasible to do it. It needs some careful training in how the questions are administered, but actually it's not too time consuming. It is possible even with non-specialists. From the experience that we had, and this actually was the same in India as well, that parents do appear to want their children with disabilities to attend school, and that many of them are in mainstream schools. That approaches to inclusive learning, which will benefit everybody, are necessary to support children with disabilities once they're in school. So it's not enough just to focus on the access, which has been the attention that has been given generally in a lot of countries, both in national strategies as well as globally, and that there's a need to support teachers in adopting appropriate strategies, and that using what some of them are already doing as a starting point, recognising some of their good practice, recognising that things are happening. Just to put this in a wider context, so as you probably know, David is responsible for this Raising Learning Outcomes programme for grant holders, which I think, how many are there now? About 31 in total. Of these grants, there are 5 or 6 that focus specifically on disability, and we have produced with Elizabeth a short summary of, is it 4 of them? Four of the projects which you can find online on the Impact Initiative website, and the ones focusing on disability and education. Each of them are just a page summary of what that research is. There's something that gives the key messages, and there was a forward by somebody from who's the head of Plan, who was sort of saying about how this type of evidence fits into advocacy, and is how it's sort of important for those purposes. So you might be interested in looking at it. It includes a summary of Paul Lynch's research within there as well. And very finally, if you would like to come to the other place, on the 9th of March we have a day event which is celebrating the work of Professor Christopher Colclough, whose work you might have read. He did a lot of work on states and markets, an economist of education, so really, I think, important, insightful work in a number of areas. He was also the first director of the Global Monitoring Report. He established the Global Monitoring Report. He sadly died last year, so we're having an event to commemorate his work from a number of people who have worked with him in a variety of ways. So you're very welcome to attend. There's a Eventbrite to sign up. Places are going fast, so do sign up if you're interested. And I'm very pleased to see you there. So thank you.
Thanks very much.